what we see for you is that we have a prior surgical defect here where you were operated on elsewhere. That area needs to be repaired, and that repair is going to have to take in. But because of that operation, we have an additional problem where we need some extra support in the spine. So we're going to support the spine where the bone has failed. We're going to place metal into the bone surrounding that, and that metal is going to take up the stress. And then in the front, we're going to place some of your bone along with some bone that's donated, just the calcium portions of the bone, into this area that's going to grow into one solid shred of bone that's going to keep everything in place. And we know that also at the level above here, we know that there is a known issue with the support system at that level, but that support system appears to be working okay, and we're going to allow for that to continue to work like it is. If at some point in the future it fails, then we'll deal with that when it fails. That level does not appear to be moving, does not appear to be a very problematic level for you, but if you were to experience pain at a later time that was similar to the pain that you're experiencing right now, that would be the first suspect that we would look at, because we know that that level can fail, that we're going to put some support in below, so we're going to make that stronger, so the level above is going to be under a little bit more stress maybe than it is right now, but that there's nothing I can do to control that. I need to get you the support where you have failed.
Right.
But that level has a potential to have some failure at some point in the time. The kinds of things that you can do to reduce the risk of the failure are reduce the stress on the spine. What's the stress on the spine? The amount of weight that you're carrying above that area, right? So the best you can do.
You better turn that off right now.
No, but this is for everybody. This is for me. This is for anybody around. That the amount of stress that we carry in the spine is all the tissue that's above this area. So our overall aim for you is, once we can get you up, once we can get you walking again, once we can get you into a more active state, that we set a goal that we're going to start trying to lose some weight in the upper section to try and reduce some of the areas here that are stressed out, okay?
It definitely has affected my exercise.
It always does. It's never a situation like you can enter into a situation where you can't move around. You got to move around with a cane. You're having difficulty moving the legs and staying stable on them, and then you can do some kind of an exercise program, or even walk, or do gentle stuff to try and lose weight. It's too dangerous for you.
Right.
So I understand.
Okay, cool.
Okay.
Thank you so much.
You're very welcome.